This is a scary moment, and for too many, it's been devastating. From the murderous malfeasance of this White House to the Black and brown communities emerging as epicenters following centuries of structural racism, to the Republican judges and lawmakers who put people's lives at risk in Wisconsin, but we saw the defiance of voter suppression, and to the upending changes and the terrible weaknesses of our system, economic, political, other, exposed by this virus. But it's also a moment where people are looking for connection and re-examining long-held views and willing to entertain big, bold, progressive ideas they might not have considered a few months ago. And that's one reason it's so important. And I'm so happy we have Pramila Jayapal, Representative Jayapal, with us today. You know, about a year ago, we ran a cover story on Pramila, if I might, how Pramila Jayapal's inside-outside strategy is changing the future of progressive politics. The Congresswoman is a lifelong organizer. She is an immigrant rights organizer, public health organizer, and now she's one of the key players in Congress. I venture, if I might, think you're talking with the future Speaker of the House, but that's my speculation. Since then, we've reported on Pramila Jayapal's remarkable work as a pragmatic legislator of bold vision and courage. She's always working toward a goal, as she likes to say, quote, to change beliefs about what is possible and then figure out how to move things on a tangible level. Personally, I just wanted to say I met Pramila in November 2015 when the nation marked its 150th anniversary. And at Seattle Town Hall, we asked a number of people, Pramila, a key member of the Seattle community, then a state senator, to read from the nation's archive. And naturally, Pramila read Eleanor Roosevelt's 1940 article from the Nation that fear is the enemy, as it is today, fear. Since then, the Nation has been a great admirer. We've done a lot of coverage of her work, and Pramila is an author, having written since 2013 for the Nation, most recently on Citizens United and its devastating impact on our politics. Congresswoman Jayapal now serves her second term in Congress, representing Washington's 7th District. She's the first South Asian American woman elected to the US House of Representatives, a member of the House Judiciary Committee. She's also the elected co-chair of the Congressional Progressive Caucus, which if you don't know about, you gotta know about, represents approximately 40% of the entire Democratic caucus. And Pramila's work gave the caucus members some key positions, committee positions in the House. She's also a member, co-director of the Congressional Progressive Congress Center, whose board I'm proud to serve on. It's a group which is strengthening ties between movements, policy groups, and progressive electeds, and in these last weeks has been at the center of real-time analysis of the stimulus program so vital to jumpstarting this country's future. I just wanted to say, just in closing, in Congress, as Jayapal's been a leader on immigration, we're going to talk briefly later about her legislation she co-sponsored yesterday with Senator Booker on releasing immigrants from detention in these times. She's been a leader on the inequality front. She's been an extraordinary and important leader on healthcare issues and author of the Medicare for All legislation in the House. And in the midst of the pandemic, Pramila has sponsored two major pieces of legislation, Emergency Medical Guarantee with Senator Sanders and Paycheck Guarantee Act. So I also wanted to say her book, I believe this is the case, your book, Use the Power You Have, a beautifully, passionately articulate manifesto memoir and guide to change, is out this June. So it's really an honor Pramila could join us today. And I know she'll answer many of your questions as to what we can do as a community in these times. I'm also very pleased that Representative Barber may join us next week, Bill McKibben in a few weeks, Representative Jamie Raskin with my colleague John Nichols, our National Affairs correspondent, and Zephyr Teachout are a few of those who will be joining Nation breakfast conversations. So I wanted to turn it over to Pramila and just say how, you know, part of what the Nation does, our journalism, which Sarah spoke eloquently about, is lifting voices like yours and early on, and then the mainstream picks it up, but it's not just your voice, but the bold ideas you've been so central to seeding and nurturing and offering this country. So thank you, Pramila, for being with us.
Thank you so much, Katrina, for that incredibly generous introduction. And let me just say the nation is top of my list in terms of where I get my analysis, the community that I can be a part of in thinking through what is so important for us to address. And I'm just so grateful for our partnership and for all of your work in helping us to build the kinds of institutions that we need as a progressive movement as we go forward. So it truly, truly is a pleasure and sort of a moment to lift up my heart in being with you all today. I know that this is a time of tremendous anxiety and uncertainty for so many people. And I just want to acknowledge first and foremost, if you've lost somebody, if you're related to somebody who has lost somebody, if you are facing anxiety in this moment for whatever reason, our heart goes out to you. And of course, I can't do anything these days without giving a particular thanks to the essential workers that are on the front lines of this crisis. And I'm talking about, of course, our healthcare workers, but also our grocery store workers, our garbage sanitation workers, postal service, and so many more that are out there doing the work we need to continue as a nation. This crisis has already taken 26,000 American lives, more than we lost on September 11th, 2001, or during 19 years of war in Afghanistan. My own district here in Seattle, hello to anybody who's out here on the West Coast or in Washington State, and my state of Washington was hit first. First case of coronavirus was diagnosed on January 21st. So almost 12 weeks now, and we were hit hard and early. So we have had more than 10,500 cases and over 515 deaths, a number that I'm sad to say is starting to pale in comparison to some other states, and sad to say in the sense that other states are dealing with even more than we are. I'm happy to say that because I think that part of the reason Washington State has been able to sort of get over at least what we think might be an initial hump, we are far from out of the woods, is because we took a very proactive approach to this. And because our state, in spite of federal disinvestment for decades in public health and resources, in science and technology, the state has actually done a very good job of maintaining some very good public health systems that are underfunded, of course, but that know that they have a priority in our legislators' minds. But also because our governor, our King County executive, our mayors immediately took steps to pay attention to what they saw unfolding and immediately put in place restrictive orders around physical distancing that would help us to address some of the crisis that is before us. But I think that our state and our nation are still not in the clear. And this pandemic, in my mind, is showing just how badly we need transformative change, just how broken and piecemeal our current systems are, and just how much we have to rise to think about solutions that will actually match the scale of this unprecedented crisis that has now got every single state in the union under a major disaster declaration. So let's just focus on that for a minute. What is the scale of the crisis? In just the last few weeks, more than 16.8 million working Americans have already filed for unemployment. And that's just the start. We'll see new numbers tomorrow. These Americans, by the way, aren't just losing their income, they're also losing their health care and their benefits. Before this crisis, we already had 30 million Americans without insurance, health insurance, 40 million that were underinsured, but that number is skyrocketing right now. Estimates are that we will have an additional 35 million Americans who will lose their access to healthcare right in the midst of a global healthcare pandemic. The last thing that anybody should be worrying about is whether seeking testing or treatment will bankrupt them with $34,000 bills, or how they're going to get the care that they needed even before this crisis hit. Meanwhile, our current relief systems are failing us in delivering the kind of expansive and immediate relief to people that we need in a time of massive devastation. Here in Seattle, we've had people who have been laid off for 2 months already. They're coming up on a third month of being without a paycheck, being without any relief, because we still haven't been able to get relief out to them. There is a tension that exists between using existing systems to try to push money and relief out as quickly as possible, and trying to think boldly about a streamlined and effective and expansive way to meet the scale that we're talking about. State unemployment insurance offices are doing heroic work, truly heroic work, but they aren't designed or resourced to meet this level of demand, nor could they cover anyone, even if we expand substantially those systems as we did in the last CARES package, with the largest expansion of unemployment insurance that we have had in decades. Very critical point. The US Small Business Administration's Paycheck Protection Program that we passed in the last CARES Act was based on some good principles, but too many individuals and businesses, including the smallest minority-owned multilingual businesses and populations, a number of restaurants, have never engaged with these systems before. And they have no idea how to start, nor in many cases do they qualify, no matter how the programs may be structured. We are layering tremendous crisis on top of an already deeply unequal and inequitable system, which the nation has done such a phenomenal job of reporting on over the years, where we have faced the worst inequality since 1920, where 60% of Americans did not even have $400 in their bank accounts for an emergency, even before we hit this crisis. So our work now is to think boldly about the intertwined problems of the public health needs and guidance, testing, personal protective equipment, domestic manufacture and supply of the critical items that we need, but also the economic system. They are deeply intertwined, and all of the supports that people desperately need, but in fact are losing, not gaining during this crisis. I have said recently that mass unemployment of the nature that we are seeing and likely to see even more of is a policy choice. Countries like Denmark and Germany and France have chosen differently, and we have to do the same. And that's why last week I rolled out a federal Paycheck Guarantee program that would cover businesses, nonprofits of all sizes, as well as municipalities that are starting to have to lay people off as well. The Paycheck Guarantee Act would stop mass unemployment by guaranteeing paychecks and benefits to keep people on payroll through this crisis and allow relief to businesses and nonprofits and to workers who desperately need the guaranteed stability of their paychecks in order to survive. The proposal would essentially, and I'm happy to take more questions about this, but essentially it would allow the federal government to cover 100% of wages for workers earning salaries of up to $100,000, so that employers can pay employees rather than pushing them out to the unemployment system. It would also keep workers enrolled in their employer-sponsored benefits, including healthcare. It would encourage workers to rehire recently furloughed or laid off employees, because we made the program retroactive to March 1st. It would cover essential business expenses like rent and other maintenance operations for businesses to keep things going during the crisis, so that they can open quickly and not have to go through a 3-month period where they have to rehire, retrain, and get their business up and running, but that they are ready to reopen, even if it's partial, and our program accounts for that flexibility of partial reopening or even reshuttering if we have a second round of infection. It gets workers and employers support quickly by using the existing payroll tax infrastructure to facilitate the delivery of payments, and it keeps workers attached to the labor market again, which is so important for any kind of a speedy economic recovery, but not too speedy. We want people to heed public health guidance and have an incentive to not go back to work too quickly, not reopen the business too quickly, but to actually follow the public health guidance and not be driven to it because you fear you're going to lose your business if you don't reopen, or you fear that you don't have food on the table if you don't get back and find a job. So rather than using the SBA, a network of banks that many people don't have relationships with, or a whole host of pieced together systems, this proposal would be very quick and speedy. Separately this week, I'll be rolling out an additional set of proposals to address healthcare. Last week, Senator Sanders and I rolled out a proposal that would essentially cover the costs of everyone that is uninsured that comes to get any kind of treatment during this crisis. And that is both for COVID, but also any other kind of healthcare treatment. It just essentially has Medicare cover those costs. This, frankly, is far less expensive than, for example, some proposals to expand subsidies for COBRA. That proposal, or a set of proposals that I'm getting ready to roll out this week, would deal with this healthcare situation far better. The pandemic has made clear what we've been saying for some time, that employer-based healthcare does not provide real choice, because when you lose your job, you lose your healthcare. That is hardly a choice. But it's more than that. Imagine for a minute if we actually had a Medicare for all single-payer system, we would have been able to respond far better to this pandemic. We would have had a centralized system that could have been mobilized very quickly to ensure universal coverage, contain costs by negotiating drug prices and treatment and vaccines, and also medically necessary equipment like ventilators. We would not have had such a vulnerable population that has had decades of delayed healthcare that left them at serious risk for the chronic conditions that make people susceptible to the virus in the first place. And let's also be clear that the tremendously disproportionate effects on Black and Brown and poor communities that are part and parcel of a broken healthcare system has been centered in this crisis. In Chicago, 71% of the fatalities are African Americans. Similar numbers in Milwaukee County, up to 81%, and similar in Louisiana. Poor folks who live in smaller living spaces don't have the ability to isolate themselves if they have the virus. And people who are in jails and detention centers have no ability to practice CDC guidelines when they're piled in there with no soap and no ability to physically distance. So that is why both Bernie Sanders and I have been focused on this, and I will be rolling out proposals this week to expand both Medicare and Medicaid to cover both those who are on unemployment and those who are uninsured. Before I conclude, I'll just highlight one other proposal that I know we're going to talk about as well. Yesterday, with Senator Booker, I introduced a bill on a subject that I have been working on for 20 years, and that is around immigration. And specifically, my bill focused on the detention systems and really making sure that we protect those who are in our jails, our prisons, and our immigration detention centers. You know, somebody said to me that everyone depends on the government in different ways, and we're finding out just how much. But people who are in these jails and prisons and immigration jails and prisons are 100% dependent on the government. And the concept in these holy holidays that so many are celebrating of the last coming first, I think is absolutely essential. So my bill specifically details how we can release the vast majority of people that are in detention, because the vast majority have never committed a crime, much less been charged of one. They're asylees, refugees, waiting. And if they do have, waiting for a determination from the federal government. And if they do have any kind of a crime that they've been charged with, most often it is something like marijuana possession, which is now actually legal in so many states across the country. So these folks can be released. They should be released in a thoughtful way that takes into account public safety, but also recognizes their dependence on us to keep them safe, and the public health risks of people who work in detention centers, and the way in which something like this can spread not only within the carceral system, but also in the general public. So let me close where I started, which is that I think that this unprecedented public health and economic crisis has revealed the problems with what I call the me first society instead of a we first society. But I have unshakable hope as an optimist, as a member of Congress, that we can fix this. It requires us to rise to the occasion, to be bold in our thinking, and not to be limited by what we think might be possible. Everything that has ever been possible in our country has happened because we've changed and pushed the boundaries of what is seen as possible. So I am so grateful to you, Katrina, and to the nation for constantly allowing us to do that time and time again with your reporting, with your stories, and with all the work you do to lift up these issues. Thanks so much, and let me turn it back to you.
Thank you so much, Representative Jayapal, for reminding us not just of the importance of transformative change, but laying out so clearly with the 3 bills how this is possible. You've said and paraphrased the great Frederick Douglass that power concedes nothing without a demand. You've laid out 3 pieces of legislation which just make humane, concrete, powerful sense. As someone said the other day, reality has endorsed your proposal, Senator Sanders. What can we do on this call? Because you are someone who understands the power of that inside-outside politics, the power of movements, of media, of citizens to drive change, working with elected allies like you inside. What can we do?
Well, to the title of the book you mentioned that's coming out, I think we have to figure out how we use the power we have. If you are somebody who is well-connected, but knows that what we need to do is to be bold, then I would encourage you to reach out to the people that that have at least legislative power to say this is not a time to be small. We don't get do-overs on this. Once the economy goes into a downward spiral, it rests in a downward spiral. It rests at the bottom of that spiral. So I think if that's the kind of power you have, using it behind the scenes on that sort of inside strategy is really, really important. If you are somebody who's a voice for essential workers and the advocacy movement more broadly, I don't think we should think about this moment when we are at home as being a moment to suppress our voices. There is a lot of organizing happening across the country, both in service to essential workers who are not having their voices listened to, but are putting their bodies on the line for us, but also in terms of mobilizing support within Congress for these ideas. If you are in an academic institution, you can be lifting up these same ideas with your platforms, whether through op-eds, whether in your classes, whether through online sessions that really pick up the momentum. I've been amazed to see the momentum around the Paycheck Guarantee program, as I was saying to you, not even people that we knew or were engaging with, but people who saw the rollout and immediately weighed in with op-eds in major papers. And so I really think that lifting up stories, lifting up voices, and lifting up the connections that you already have are so important for everybody on this call to be thinking about.
Thank you. I'm going to turn it over to Erin, if I could, to field some of the many questions I see coming in.
Sorry, I was muted. Apologies. But we do have lots of questions. Jordan is asking, I guess, really, how far are the Democrats willing to go to make sure that there's funding in the next emergency bill for the USPS to preserve voting rights, to create more testing, and what about paycheck protection? So is it possible that we'll see the Democrats demanding that these things be mandatory in the next funding bill? How do you see that going?
Yeah, well, I think it all depends on both how we do in lifting these things up and advocating for them, and also what happens with our leadership. I mean, I think both things are important. And then, of course, what happens with Republicans. The postal system relief was supposed to be in the last CARES package. It was stripped, as were a number of other ideas that Democrats had. And one of the challenges with unanimous consent, because we're remotely voting, is that it becomes very hard to pass anything that does not get full bipartisan support. Now, that was true before, but there were ways to use the legislative process to really push Now, in some ways, it has concentrated power in the hands of very few of our legislative leaders, and they've been doing a fantastic job on the Democratic side. Speaker Pelosi and top folks have been doing a fantastic job, but I don't think this is a moment where one person can negotiate everything. I really do think that we're going to need everybody. And so the challenge is, when you have a crisis of this level, do you say we're not going to do anything until we get what we want? And we have done that to a certain extent. And for example, there's a push to make the PPP program, put more money into that program without doing any fixes to it, without taking on the money that state and local governments need, without taking on the safety net systems and expanding SNAP or WIC. And Speaker Pelosi and Chuck Schumer have said, no, we're not going to do that. We're not going to do that. So these are the challenges we face, and it's why the movement of advocacy is so very important, because I think both the tension of needing to get immediate relief to people and the fact that we don't really have a legislative process that allows for the kind of inclusion that perhaps we've had in the past limits some power, but not all power.
Mm-hmm.
We have a question from Three Rivers, California, a question again about aid. Is there anything specific that helps the self-employed, like gardeners or people who do home care?
Yeah, so the unemployment insurance expansion in the CARES Act did actually set up a piece within the unemployment system to take care of independent contractors, gig workers, folks like that. As it turned out, the way the rules were interpreted, both for another program through the PPP, which was also intended, that's the Paycheck Protection Program, not the Paycheck Guarantee Program, I want to be clear, which is my act, but the PPP program, which was supposed to distribute money to small businesses across the country, that program also is supposed to cover independent contractors. Domestic workers have really been left out. The way Treasury interpreted the rules, household employers don't qualify. Many domestic workers don't qualify. And I should mention that many immigrants, based on immigration status, not just the undocumented, but DACA recipients and green card holders, also don't qualify for many of these benefits. So we don't have the kind of coverage that we need. I believe that my Paycheck Guarantee program would actually do far more to cover, and it would be open to some of the folks that your questioner had asked about. However, I would just say there are some specific pieces of relief that were in CARES that were designed to cover those people as well. So I know our office is helping people sort through those, and I would just recommend that you work with your congressional office or your state unemployment insurance system to figure out what you do qualify, because we did include some of that in some of the pieces we passed.
Speaking about health insurance and the large number of people who are uninsured right now, is there an opportunity to get insurance still on the networks? Are there impediments to getting coverage? Do you have any information on that? That's from Nanette Kochi.
Yeah, Nanette, this is the big problem that I was speaking about, that people, the Republicans have refused to expand ACA enrollment. I actually think that the Affordable Care Act is far more unpopular, unfortunately, because it did a tremendous amount of good, but it's extremely unpopular with Republicans, and they're refusing to even expand enrollment. So we have to be creative about how we cover this. Debbie Dingell and I sent a letter to Donald Trump because he actually said he wanted to expand Medicare. And we said, well, if you're serious about that, we have some proposals we'd love to work with you on. Probably no surprise that we haven't gotten a response to that. But I do think that this is a moment to, whether we use Senator Sanders and my proposal of covering all the healthcare costs for anybody who seeks healthcare treatment during this crisis, using Medicare to cover that, or whether it's an actual expansion of Medicare, which will be the proposals that I'm rolling out this week, to expand Medicare to cover those who are on unemployment insurance, and then to expand Medicaid to cover those who are uninsured or close to the poverty line. Those pieces of how we deal with healthcare are going to be really important, because I know that for Nanette and for so many others across the country, this anxiety around healthcare when you already didn't have what you need. Now perhaps you've lost it, or you've got additional health concerns due to COVID. This is a really important time for us to respond to that. The proposal that was just rolled out by Speaker Pelosi and others on my side, I will just say I don't think that expanding subsidies for COBRA is the most efficient way to do things. It's incredibly expensive, and there are better ways to do that. So I hope that we take into account those better ways.
There's a lovely conversation starting in the chat, checking in on emotional health. And so the question to you is, how are you doing? How's your staff doing? What are you doing to cope in this time? And then I guess part two, when I'm reading in the chat, is, what does it look like to come out of this? And how can maybe the more vulnerable who are at home have a part in helping others through this moment? And then what do you see about the transition out?
Yeah, what a beautiful question. My staff is amazing. I mean, I really, we have Zoom calls with senior team every single day. I am talking to my full team at least once a week, sometimes more. So in some ways, we're really trying to stay more connected than ever before, because we know how important it is, and frankly, no work gets done without that. But I think the hardest hit are probably those who are, dealing with their own situations, whether it's childcare and kids running around at home, or at the same time, concerns about their parents, elderly family members, other family members. So I think it's a time of anxiety that reflects where the American people are. I would just say that, we've always said that we're interconnected. Dr. King's beautiful words about the tapestry that is interconnection. This crisis is showing us that more than ever. I mean, if there was ever a time to know that simple truth that we're all better off when we're all better off, that is now. And so in some strange way, perhaps the underlying values that so many of us in the nation community have been pushing out for a long time around that interconnection and the need for us to be close to each other and advocating for all, including the most vulnerable, perhaps that's coming to clarity far more than ever before. And I think that, I have never used the term social distancing. If you look at any of my emails to my constituents, I use the term physical distancing, because really what we want to be doing is physically distancing, but emotionally closening. And that's what I say to all of my constituents is, I have this unshakable faith. I was rereading Archbishop Tutu and His Holiness the Dalai Lama's conversation in the Book of Joy. And there's this wonderful section of that where Archbishop Tutu says, hope is very different than optimism. Optimism and pessimism are ephemeral. They come and they go. They're just how you might feel in a particular day. Hope is this unshakable faith. It's in your tummy, not in your head. And it is a deep belief that when we do the best that we can do, and when we come together to have this kind of collective power, we will triumph in the name of justice and righteousness. So that's how I think about it. And my heart goes out to everybody who is suffering. Take care of yourself, take care of the people around you. I have been really, as I've gone out for my physically distanced walks in the neighborhood, I have loved seeing parents playing with their kids and people going for walks and, people getting their hands in the earth and gardening. Because I think that these are things that perhaps we've lost in our society. So if there is any silver lining in this, perhaps it's that sense of, we need each other.
I should have changed the order. That would be a really high note to end on, but we have more great questions. So let me get to them. From Wilton, Connecticut, in light of the Wisconsin primary, what can be done to ensure that people have access to mail-in ballots? And wondering also what your reaction to President Trump's comment that mail-in ballots would undercut the ability of Republicans to win might have been.
Yeah, it's just such craven partisanship and such a disregard for the right for people to vote. Wisconsin showed us very clearly, and my co-chair, Mark Pocan, has written a great article on Wisconsin and the elections and why we have to be protecting the right for people to vote. And we have, within the Congressional Progressive Caucus, we just released a set of priorities for the Progressive Caucus, 4 main buckets, the last of which is, the first is paycheck and payroll guarantee programs. The second is safety net services, expanding those. The third is public health and protecting public health. And the fourth is ensuring our elections are able to proceed. And we say that, first of all, we have to guarantee all 2020 federal elections can proceed by vote by mail, that states should have the resources. We're proposing $3.6 billion in additional funding to states to be able to transition immediately to these vote by mail systems. And that is just critically important, because if Wisconsin showed us anything, well, it showed us 2 things. One, that you really can organize and you can win, and vote by mail is certainly a piece of that. But the bigger piece is how you organize, even in a crisis, to get turnout. We in Washington State had the largest turnout in a primary election, presidential primary election, that we've ever had. And that was right when the pandemic hit us in Washington State. So we know vote by mail works. Republicans know that too. That's why Donald Trump doesn't want it. It's not about partisanship. It's about giving people the right to vote, but and the ability to vote. But he knows that if we do that, we get a much larger population of people voting, and he thinks that's not good for Republicans. It is good for democracy, and we're just going to have to continue to push to ensure that we get that protection.
So I guess building on what you were talking about, the momentum from the Congressional Progressive Caucus, what are you doing to support and promote the progressive movement now that Bernie Sanders is out of the race? Is there conversations with Joe Biden happening? Are you thinking about even beyond the 2020 elections? And this comes from Fresno, California.
Yeah, so we, obviously I was a big Bernie Sanders supporter. I was so proud to have campaigned fiercely by his side and on his behalf across the country, with crowds as small as 100 and crowds as huge as 25,000. And so we, there's celebration to be had for what Bernie Sanders has done for our movement and for progressive ideas, and moving things that were seen as completely impossible to moving them into the mainstream of the conversation, whether it's the Green New Deal or Medicare for All or any of these ideas. He has always said that this isn't about him, not me, us movement. And so we now have to step up. Yes, there have been conversations between Senator Sanders and Joe Biden. I spoke to Bernie this weekend, and the idea of forming task forces is part and parcel of those negotiations. I assume we'll see something around that soon. And I think that our work now is to help Joe Biden. We have always said we will support the Democratic nominee. I said that a long time ago. Bernie said that as well. But in order for Joe Biden to win and defeat the most dangerous president in modern history, we are going to have 2 things happen. One, Joe Biden will have to step up, and we will be by his side, sometimes behind him, helping him, sometimes in front of him, pushing some ideas. But we will need to help Joe Biden embrace some of the ideas that generated real belief that government could make a difference, that people were willing, that there was somebody willing to take on the power interests, the special interests that have transformed the system to not work for them, and so to not work for regular folks. And so that is the work that we're going to have to do. This is not something where you switch a light switch and because Bernie says or I say vote for Joe Biden, it's going to happen. We're going to have to build a platform that engages, enthuses, and inspires people to believe that Joe Biden will make a difference. Now, clearly, Donald Trump is horrendous. There is no comparison here. But the fact that people are facing such unprecedented inequality is actually what led to Donald Trump being elected in the first place. And if we don't pay attention to that, and if we don't try to get our young folks and our immigrants and people to turn out and to vote in big numbers, I don't think we're going to be successful. So that is the work now in front of us. And I'm looking forward to being a very productive part of that work and supporting Joe Biden as we seek to take back the White House and the Senate and keep our House majority. Critically important. But we need to have a platform that is going to recognize the scale of the crisis that existed before coronavirus even came into being, but certainly now is clarified with a shining light.
So that work and that outreach that you mentioned is made harder by something that a few people have brought up in the chat or in the Q&A, and that's what someone's calling campaign stunts by Trump. And so one example that's come up a few times is that he's signing the stimulus checks that people will see, and that's never been done before. I think in the press conference yesterday for the update on the virus, he played essentially a campaign video. I wonder what you think of that. How do we as the media, we as people, you as representatives, help, I guess, push back against that? And how can we make a difference when we're facing that kind of, I guess, propaganda machine?
It's horrendous. It's absolutely horrendous. We can't, though, allow him to drive the conversation. I thought about what would happen if every time anybody had coverage, and the nation does this already, but even on television, mainstream networks, if while they're showing Donald Trump, if they're going to show him speaking, that they have a side panel that is constantly detailing all the myths of what he is saying in real time, that you would say, this is not true, this is not true, this is not true. So that if you're going to cover him, let's also cover immediately, not wait for people to go look it up later, but immediately cover everything that he's saying that simply isn't true. I think that we've got to come up with some creative strategies around that to highlight what he's saying that is not true, but also to not let the conversation be dictated by him. This is what we've learned. He's very good at controlling the narrative. I think it is a little bit harder for him now because really the only platform he has is those rambling press conferences that make no sense whatsoever. And a lot of people aren't tuning into them anymore. Now, the people that always tuned into him, they will always tune into him, 30% of the population. But you notice that people are getting very frustrated by his partisanship and his self-promotion in a time when we have the most number of deaths of any country in the world, where we have now evidence that says that delaying by 1 week cost us tens of thousands of deaths in the United States. And so I think that this is an opportunity for us to keep our focus on our message, to, if we're covering him, simultaneously in real time, cover the things that he's saying that are not true, but let's not let him take us off of the core ideas here of what we need in this moment. Bold leadership around how we address this, whether it's Elizabeth Warren's plan, Bernie Sanders' plan, hopefully Joe Biden's plan to really come out of this, ideas like my Paycheck Guarantee program. I mean, these are the things that we need to be putting out there and pushing, not acting like, we're defenseless in the age of Trump. We're not. We never have been. We won't be as long as we engage.
So our time is coming to a close. I think we have time for one or two more questions. We'll see. But before I do the next question, I just want to let you know that there are several shout outs in the chat, thanking you for being here and telling you that you're awesome. And thank you. We really appreciate it. I'm going to take two questions and just roll it into one. You've touched on it a bit, but people are wondering, what can the average citizen do to help, and rolled up in that, and that's to help shift national priorities, and no matter who wins, what could we do? And someone's also asking, what can we do to help those 30% who still support our president despite the harm?
Um, in terms of the 30%, I I think that we have to focus our energy where we think we can really make a difference. And that is, I always used to tell people when I was an organizer, there's 30% of people that agree with you no matter what. That's great. Go talk to them, make sure they're fired up to be a part of the movement. There's 30% of the people that will never be with you. And then there's people in the middle who aren't really sure. They're looking for a way to think about things. We do have, and when I say middle, I'm not talking about political middle necessarily. I'm talking about people who perhaps have had experiences that put them in a place where they don't really, there's too much conflicting information, and they're looking for somebody to help them think through these things, not to be judgmental, not to look down on them, none of that, but to engage as equals in a conversation about what is going to help their lives be better. And I think that is where we should focus our energy. And I also think that no matter who you're talking to, empathy and compassion go a long way. I remember early on in my time in Congress, I was on C-SPAN and I had this caller call, very anti-immigrant caller, and talk about how his son was losing his job because of immigrants, illegal immigrants, et cetera, et cetera. And the first thing that I thought about when I was listening to him is, wow, he's in a lot of pain. And that's the way I responded. Then I went on to say why he was blaming the wrong people. But I think if we can bring that compassion and empathy in, that's super important. To the first part of your question about what people can do, I think it's the things I spoke about earlier, in terms of using your power in the different ways that are there, whether it's public advocacy, whether it's private advocacy with people that that have elected power, or people that who are connected to people. We do power maps where we look at, who does X person that we want to influence go to church with, or synagogue with, who are their kids friends with, who influences the way that they think. And I think if people could think that way, that would be very helpful. But I do want to say something about also the small things that people can do. They are really important. The way a neighbor here in the Seattle community wanted to help a small business that delivers flowers, a Vietnamese woman, entrepreneur, and she called her up and she said, hey, if I could get a bunch of people to agree to buy flowers from you because I saw you were going out of business, would you just deliver it to the middle of the street? How much would it take? And the woman said, the business owner said, if you can get me an order for $120, I'll deliver flowers. Well, she got an order for $1,200, and there was flower distribution going out in a physically distanced way in the middle of the street. There are meals being delivered to people who are on the front lines. There are just masks being worn because we need to protect the grocery workers if we have to go into the grocery store. There is work to buy from independent businesses and not just through Amazon because it's easiest, but to search out ways to buy things directly from independent businesses. Those are part of that network of connectedness that we need to continue to strengthen. So don't discard those either. And I think, have that unshakable faith, and remember to pay attention, not just to your head, but to your tummy, because that's where real hope and unshakable faith lie, according to Bishop Tutu and His Holiness. And I think they're pretty good guides for me.
Well, we have many more questions, but I think that's also an extraordinary note for us to end on. So I think I'll throw it back to Katrina and see if she has any questions and close. And thank you very much.
Thank you.
Pramila, thank you so much for your humane, compassionate talk. I've been signing off. You also speak so eloquently about what is revealed by this crisis, the pre-existing condition of this country, and you lay out the bold ideas needed. I've been signing off on so many emails. May compassion, courage, and community prevail. Listening to you today, I believe those qualities, the best in this country, will prevail. I want to thank you also for being such a leader and for your words about the nation, because we have been at your back and lifting up the ideas, the bold ideas that I think are so vital at this time, and to be the power in an independent free media, which I think is so needed in these times, not only to be a watchdog, but to lift up the bold ideas. And so we will be following your work. We will be writing about it as we have. We're proud to be in a community with you. And I just want to thank the community which joined our call and say, you know, every part of our society is being ravaged. Frontline workers, and we're covering the perils of frontline workers. We cover the claps that I hear every evening here at 7. I don't know about your community, that are about support for the frontline workers, the first responders, the healthcare workers. But we also need to be doing more. And I think we have people inside Congress like Pramila Jayapal. We understand that this country will survive, not only survive, but prevail. And so thank you. The nation is stable. It's been surviving for 155 plus years. It's going to thrive. But if you find it in your heart to support us, or even take out subscriptions, digital or other, for those in your community, we would be grateful, because we are part of the work Pramila spoke so eloquently of, the transformative change, the bold change that we're going to need to come out of this and be a better country, a more humane country. And thank you, Pramila, for reminding us of what real hope is and for your work. We will be following you and grateful for your time amidst all today.
Thank you so much, Katrina, and to all of you at The Nation. You're amazing, and I'm so proud to be in this with you.
Thank you.